The nature of today's environment dictates that we must be prepared to meet a variety of challenges and threats posed by natural and unnatural events. It is for this reason we must recognize, plan for, and act to eliminate the situations that could threaten the citizens of Pinellas County. Special needs shelters are primarily set up during a hurricane evacuation, but could also be utilized for other natural or man-made disasters. These shelters accommodate our county residents who require assistance due to physical, mental, or sensory disability that exceed the basic level of care provided at general population shelters, but not the assistance that would require the skilled medical care of hospitals or nursing homes. Since space in a special needs shelter is limited, it is important that evacuees without special needs be redirected to general population shelters in the area. Examples of special need clients may include an individual who has chronic pulmonary conditions that require supplemental oxygen in the form of an oxygen concentrator or small travel tank, or an individual with limited mobility that requires wheelchair assistance. Persons who would not be considered special needs shelter clients include an individual who requires continuous oxygen support via a ventilator, or an individual who is completely immobile who would require the use of patient lifts to be moved. These individuals would require more skilled medical care that is not available at a special needs shelter. There are 3 locations within Pinellas County that have been designated as sites that serve as special needs shelters. These locations were selected to accommodate clients that live in the north, central, and southern parts of Pinellas County. Dunedin Highlands Middle School, located at 70 Patricia Avenue in Dunedin, was selected to service clients that live in the northern part of the county. Oak Grove Middle School, located at 1370 South Belcher Road in Clearwater, is for clients that live in the central part of the county. John Hopkins Middle School, located at 701 16th Street South in St. Petersburg, is for clients that live in the southern part of the county. Because the safety and security of Pinellas County residents is the top priority in an emergency shelter, staffing of special needs shelters are extremely important. During this time, the Pinellas County Health Department sends teams that include nurses, doctors, and support staff to each shelter. The Pinellas County Schools assign school nurses, maintenance, dietary, and administrative staff to each shelter, and County Emergency Medical Services, EMS, will also be at each shelter to respond to medical emergencies. Before each special needs shelter can be opened, careful planning and setup must be in place. Each shelter contains an on-site storage that holds all the supplies needed to successfully run a special needs shelter. These supplies include supply toolboxes, label cots, signage, vests, wheelchairs, and more. Typical special needs shelter clients with limited mobility will bring with them their own wheelchair or walker. In the occasion where this is not the case, there are a limited number of wheelchairs at each shelter to assist these individuals. Clients are discouraged from bringing scooters due to space and power limitations. Once it has been determined by Pinellas County Emergency Management that the shelter situation calls for the opening of special needs shelters, the Pinellas County Health Department, in conjunction with the Pinellas County School Board, will initiate the setup of shelters. As part of the initial setup, school maintenance staff along with Pinellas County Health Department forward teams will remove desks and other furniture from those rooms designated for evacuee occupancy. Each school has predetermined safe space to use in the shelters. This space may include classrooms, cafeteria, or the gym. These areas will need to be designated by the forward team as shelter operational areas such as registration, triage, electrical dependent, oxygen, childcare area, etc. Such areas, once identified, will need signage. Next, cots, which as mentioned before are stored at each shelter, will be mobilized to various areas of the shelter for easy setup. When performing initial setup of the room, forward staff must remember that in the event of power loss, those clients who are oxygen dependent must be within close proximity to a large oxygen cylinder that can serve several evacuees. During setup, forward staff should designate a part of the room that will be used for the large H-size oxygen cylinders, which will be delivered to each special needs shelters at the request of the Emergency Operations Center. These large oxygen cylinders will be used as the primary source of oxygen for clients if there is a total loss of electrical power. Clients who require a special needs shelter during an evacuation event are encouraged to pre-register with Pinellas County Emergency Management. A registration table will be set up and staffed by Pinellas County Health Department personnel. Registration process. If evacuee is pre-registered, evacuee will present identification. Printed, pre-filled information sheets for those pre-registered evacuees will be available in a binder in alphabetical order by last name. On the evacuee's registration sheet, document the date and time of arrival, as well as the method of transportation to the shelter. Verify with the evacuee that all information is accurate. Document any medications that the client might be on. The Emergency Management EM ID number will be found on the information sheet. This is the number that will be used on the evacuee's wristband. For tracking purposes, evacuees will also be issued a Pinellas County Health Department ID number. This number will correspond to the sequential order the evacuee checks in. For example, the 135th person to check in with registration will be assigned Pinellas County Health Department ID number 135. Add the Pinellas County Health Department ID number to the top of the registration form. Pre-registered evacuee and caregiver, if applicable, will be issued a wristband that will include their name and EM EVAC ID number. The evacuee will be shown to an appropriate special needs area. If the evacuee is not pre-registered, they will be directed to the medical triage area to fill out a registration form containing his or her medical information. Make sure to document all personal information, medical history, emergency contacts, arrival date and time, and transportation method. Triage staff will decide if the special needs shelter is appropriate for the evacuee. If it is determined that the evacuee should be referred to a different facility, such as a hospital or general shelter, the triage staff will work with the team leader and FOM to ensure safe transportation to such a facility if time allows. If it is determined that the evacuee is suitable to the special needs shelter, once all information is gathered, the evacuee will be assigned a Pinellas County Health Department ID number. No EM EVAC ID number will be available since evacuee was not pre-registered. The newly registered evacuee and caregiver, if applicable, will be issued a wristband that will include their name and Pinellas County Health Department ID number. The evacuee will be shown to the appropriate special needs area. Every evacuee is given an identification wristband. In addition to identifying the client by name, the wristband also lets the staff know if the client is alone or accompanied by a caregiver. The wristband color codes are as follows: purple for evacuees, yellow for caregivers. A yellow dot on an evacuee band signals that the evacuee has a caregiver. Pink for childcare. It is impossible to plan for every imaginable scenario given the unpredictability of the weather or disaster events. For this reason, managing and operating special needs shelters is a dynamic process that requires careful planning and continuous process improvement. By taking this training, you are doing your part to ensure the success of the special needs shelters.